Hi, my name's Phil. I like to talk about politics. In this video, I'd like to discuss the latest easing of restrictions in England that would be baffling if you viewed them as having any basis in medical or scientific thinking. But they do make perfect sense when you realise that they are all intended to be essentially political with a little bit of economics thrown in. So if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. Right. Now, when the regulations were last updated, I remember an almighty groan from expert legal commentators because the problem is that the regulations being produced by the government, which remember are not going through Parliament, simply don't make sense. They are often contradictory in nature, which is a bit of a problem when you're asking the police to enforce these things. And it's really because they have not been thought through. Now, the reason for this, which is important to understand for making sense of the latest guidance, is that the government knows what the scientific and medical advice is telling them. They do know that, but scientists and medics don't have control over their political safety. Now, with Boris Johnson personally, there is a bit of a pull. His politics rails against the very concept of lockdown. It's imposing rules on the way people are allowed to live their lives. It's really not a very conservative way of thinking. But he was fully seized of the need not to ease restrictions too early. He explained it himself in the way that I had seen it explained by economists, that if you do not have control of the virus, then simply allowing businesses to trade again, it's not that helpful because the workforce will keep falling ill or having to isolate. That is a nightmare for a business. And that is still the case. But the right-wing papers and his own Conservative MPs either don't understand or don't care. After all, if this goes tits up, it's not them who's going to be blamed. Most MPs are too nameless to really take any political heat from the consequences of what they're calling for, and the media have a pretty firm grip on the narrative to their readers. They will argue that, we never should have gone into lockdown in March, and then they'll argue we didn't go into lockdown soon enough in June. They will cheer our renewed freedom at the lockdown being eased now and say what an arse the government have made of it later on when we have to pay the price. And so we end up with a quite remarkable scenario like this. So from July the 4th, there's going to be more of an opening of various types of business. Cinemas are going to open up to the public, but not theatres. I mean, I have to start with that one because even I'm not sure I get that. I get some of the others. I don't get this one. I can't imagine that major studios want to release their blockbusters this year, regardless of the government's new rules. No sod will be going. How do you distance in a cinema? And don't give me any crap about, you just don't fill up all the seats. Have you ever been to a cinema? How do you get into those seats? How do you get people out of those seats without moving, quite frankly, arse to groin contact when someone wants to get out of their seat and past you? And that's to say nothing of getting in or out of the screen room. But cinemas are fine. Why not theatres? I know they said about musicals because of the singing and the extra, but theatres in general. Is it because neither is safe and theatres don't employ as many people nationally? I genuinely don't know. I'm just guessing. Hairdressers can open, but not nail salons. I mean, I wouldn't say either is safe. I'm going to keep letting my girlfriend shear me with the clippers rather than go to a barber before the scientists tell me it's safe at any rate. But how is a hairdresser inherently safer than a nail salon? This one does make sense to me though, because I think this will be driven by the fact that there'll be way more people pissed off at not being able to get their hair done than their nails. I think a lot of people, even people that like getting their nails done, will probably decide that, yeah, okay, we understand why we can't go to a nail salon, but you know what? I'm not having my hair looking like this any longer. You're allowed to stay the night in other households, but you're not allowed to play cricket with them the next day. Social clubs are allowed, but not nightclubs. Temples are fine, but not bowling alleys. So what is the scientific basis for the easing of these restrictions? On what grounds are the government claiming that we're ready? None at all, really. They've actually even given up trying to pretend that they're following the science now. They've just flatly said they're ignoring the scientific advice and making political decisions. I mean, they always were, But a lot of the government scientific advisors were keeping their mouths shut a little bit. But now they've had enough. And now the government can't even be bothered to lie about it. The reduction of the 2 metre social distancing rule was another baffling one. Boris Johnson said in Parliament, I had to watch this a couple of times, says if you can observe a distance of 2 metres, then you should. But if you can't, then you can go down to 1 metre, but try and make it 1 and a bit. In other words, what he's saying is it's not actually safe to reduce it from 2 metres, but you know what, if you can't, then all right then. All right. The government's own scientific advisors have said that these latest measures to ease the lockdown risk the virus gaining a fresh foothold. In other words, a second wave. And for my money, a second wave would surely be worse than the first. And I'm not just going off the fact that, 100 years ago with Spanish flu, the second wave was worse than the first. I just mean based on the politics. The government know that it isn't safe to ease the restrictions at all, let alone the extent to which they're doing right now, because we haven't got control of the virus. Yet they are doing so. Now that means they will not want to reimpose them, even if the numbers become obviously worse. At the moment, they are still not getting worse. It's very difficult to tell when a first wave starts and a second wave starts anyway. You do have to have the passage of time to be able to see that. But, the only way I can see them reimposing lockdown is if the right-wing press, who were never supportive of the lockdown in the first place, even though they've criticised various aspects of the government's handling of the coronavirus, they never supported the lockdown. They would have to absolutely hammer the government for not reimposing it. So they would really have to completely change their tack. And then there's the small problem of reliance for an effective lockdown on public trust in the government. Put simply, that has completely evaporated. So the second wave could well be devastating. If we do not have a pharmaceutical solution, I think that's the only thing that can save us at the moment. A vaccine or a cure. I know, there are some pharmaceutical solutions now that are useful in treating it and reducing the chances of someone dying from it, but not stopping them getting seriously ill. And if we have this second wave, of course, it could well hit in winter to be joined arm in arm with the flu. Lovely. Essentially, what these measures are about, obviously it's not healthcare related, it's about getting more people back to work. Because you can fit more than double the number of office workers, production staff, school pupils into a room if you reduce the distance from 2 metres to 1 metre. There's no scientific basis for this. The risk isn't lower now. We have more people dying from the virus now than we did at the start of lockdown. In fact, we have more people, many more people dying a week than we had died altogether when we started the lockdown. And now I noted the media were trying to spin the numbers as if it's really low now. It isn't. The Express said, this was yesterday, that we're down to 15 deaths a day. Must be yesterday. We're down to 15 deaths a day, they said. Now, not only is that a lot lower than it was, but still higher than you should be for what we're doing. But it's not even true. We're not down to 15 deaths a day. We had 15 deaths reported on Monday, which is always low because you don't have as many people working over the weekend to process the figures. Yesterday, it was 280. Of course, this is also well above the average because all those weekend deaths that have now been processed get added on the Tuesday because of the backlog. It's now filtered in. They won't be featuring that on the front page. They won't be going, it shoots up to 280 a day. No, there'll be none of that. Of course, what you need to do is the weekly average. The average for the past 7 days is 137 deaths per day. 137 deaths per day. About 1,000 in a week. Let's see the paper splash that across their front pages and tell everyone it's safe to follow this latest piece of government madness. Another thing you won't see reported in the right-wing press is one of the key tests for easing the lockdown. None of the key tests have been satisfied. But one of the key tests that should have been the easiest to assess for easing the lockdown was achieving a certain level of testing. Now, have we achieved this? No one knows. The government haven't reported their testing data for a month. Now, that alone tells you that they are really not likely to have met their target. If you'd met your target, why on earth wouldn't you publicise it? And yesterday, the Health Secretary, Matt Hancock, in Parliament, had to tell them that he had no idea how many people are tested. He has no idea. Not a clue. The Health Secretary. So there it is. Let me know your thoughts in the comments below. I hope you found the video interesting. If you did, don't forget to click the like button. If you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.